So I've made numerous videos of red flags of physical therapy, but this video is gonna be green flags of physical therapy. Ones that are letting you know that you're probably in the right place and you should probably stick with that provider. The first one is gonna be one-on-one care. You are sticking with the same physical therapist every time you show up, knowing that you're getting continuity of care and each time you are building upon what you worked on last time. Another green flag is that the physical therapist is starting with you on time, maybe a couple minutes before, maybe only 1 or 2 minutes after, but that's because they're keeping really good quality of care with the patient that is leaving. So as I come out, let's say I'm coming out with a patient, I'm 2 minutes behind. I say, hey, John, we'll see you later. Good job crushing it. Happy you're back to running that marathon. Hey, Susie, thank you so much for your patience. I'm gonna go clean the room. I'll be right back with you, okay? If they're introducing themselves to you like that, or it's the second visit, third visit, whatever, and they're making sure that you know that, hey, I am so sorry that I am late for you today. It is just because I was finishing up with that person, and guess what? I'm gonna give you the same quality of care. If you can feel that in those interactions, you know you're probably in the right place. Another one is that you are starting with the traditional physical therapy exercises, right? Like the kind of boring ones that are very specific to like just your butt cheek or just your rotator cuff. And yes, we ask you to do those 3, 4, 5 times a week because we're really trying to get you to calibrate your muscles, getting them to turn on a little bit better and work. But as you move forward 3, 4, 5 weeks in, guess what? Your home exercises are no longer 4, 5, 6 times a week. They're now 1, 2, maybe 3 times a week. Because as you go from building a good foundation to truly building strength, you only need to do that stuff like twice a week. And you need plenty of time to recover in between because guess what we're doing? We are building true strength. And for all of my weightlifters, power lifters, personal trainers out there, we know if you're trying to actually build strength, you're not gonna be able to handle that load every single day. So you need good programming ultimately, which there's a lot of PTs that simply just don't have that education, very unfortunately. I think one last green flag is making sure that you know you have a plan. At the beginning of a plan with me, our goal is to reset the pain cycle. My goal is to use dry needling, scraping, cupping, soft tissue manipulation, and maybe even like adjustments or manipulation or popping of the joints to try to decrease your pain. So you're gonna be on this table quite a bit in the first couple of visits, right? We're trying to get rid of your pain. Towards the end, you're barely on this table. We are always out that door in the gym, working out, getting you stronger, and I'm essentially fine-tuning the programming that I sent home with you. Anyway, here's some green flags of physical therapy. If you like this, please follow along. If you want more specific content, please comment and tell me what to do. If you really, really, really like this, please repost it.